Hey, what's up guys? My name is Alyssa and this is Medisin. Today we will be discussing the biliary tree and some of the diseases that actually affect the biliary system. So the biliary system includes the liver, the gallbladder, and the pancreas, all connecting through ducts into the duodenum, which is the first part of the small intestine. The pancreas creates enzymes like amylases, lipases, and proteases that help break down sugars, fats, and proteins from the food we eat so they're easier to digest. The liver does a bunch of stuff. One of the things it does is produce bile, which helps emulsify or wrap around and help break down fats so they're easier to digest and then absorb. However, we don't always need to use this bile. So in the meantime, that bile will be stored in the gallbladder. Whenever someone eats, particularly a fatty meal, the duodenum will release a hormone called CCK that will cause the gallbladder to contract and then release that bile into the duodenum to help emulsify and break down those fats. Now, everything in the biliary tree is really easy to learn because the name tells you what's going on. For example, CCK stands for cholecystitis. Chole has to deal with gall, cyst means bladder, and kinin means to move. So CCK, cholecystitis, literally causes the gallbladder to move or contract to push the bile out of there and into the duodenum. Now, we've got a bunch of different ducts within this biliary tree. And it's really important to know the anatomy so we can know how the different diseases will present and why they occur. So at number 1, we have the common hepatic duct. Hepatic means liver, so it's the duct that directly connects to the liver. At number 2, we've got the cystic duct. Cyst again means bladder, so this directly connects to the gallbladder. Number 3 is the pancreatic duct, which directly connects to the pancreas. And at number 4, we have the common bile duct, which is common to all of the ducts of the biliary system and leads to the duodenum. Right here, the opening where the common bile duct meets the duodenum is called the ampulla of Vater. Now, we've got a bunch of different diseases that could affect the biliary system. The first one we're going to talk about is Cholelithiasis. Let's break down the word. Chole means gall, lith means stone, iasis is like the presence of or disease of. So this is a gallstone disease. And all that means is that we've got stones in our gallbladder. That's it. A lot of people with cholelithiasis are totally asymptomatic. They don't even know they have these stones. However, some people, they do have symptoms. So if a person has one of these stones and they eat a very particularly fatty meal, this gallbladder is going to contract very strongly to really release that bile. That means one of these stones could be pushed into the cystic duct and block it. This will cause right upper quadrant pain after that fatty meal or during that fatty meal when we're breaking that food down. Now, if this stone dislodges and either passes into the duodenum to be released with the stool, or if it goes back into the gallbladder to chill out, and this cystic duct opens back up again, then this pain is going to be transient. It's going to go away, and it's not really going to bother this person again until the next time they eat a fatty meal. This is called biliary colic, which is this transient right upper quadrant pain that relieves and is usually associated with fatty meals. Again, it occurs when a stone gets stuck in the cystic duct, but then gets dislodged. Now, the treatment for this depends on how much the person is really bothered by it. Really, the treatment would entail a removal of the gallbladder, which is a cholecystectomy. Again, chole means gall, cyst, bladder, ectomy means take out. But a person who may not be that distressed by it may not want to undergo surgery, so it's really a counseling and conversation that has to be had between the physician and the patient. Some people, however, a stone that gets lodged within the cystic duct will not leave. When this stone gets lodged in the duct permanently, we can have something known as cholecystitis. Chole means gall, cyst means bladder, itis is inflammation. Cholecystitis is an inflammation of the gallbladder. Why does it happen? This stone gets stuck here permanently, which means this area right here is going to get backed up and just inflamed. It's going to balloon outwards and outwards without anything able to pass through, causing pain and inflammation, and proliferation of bacteria that might be lodged within the gallbladder could lead to an infection. This is cholecystitis. It's right upper quadrant pain associated often with fever because of the inflammation and infection. This requires, again, removal of the gallbladder and likely some sort of antibiotics to help with the infection. Then we want to compare to something that occurs when this stone gets lodged in the common bile duct. A stone in the common bile duct is called Choledocholithiasis. Chole means gall, doco has to deal with the common bile duct, lithiasis means there's a stone there. Choledocholithiasis, stone in the common bile duct. Again, this could present with either transient or permanent pain depending on how long the stone gets stuck there. Transient pain can lead to some sort of biliary colic situation where there's pain, and then the stone gets passed and you feel better. However, real problems arise when the stone gets stuck in the common bile duct. This could lead to cholangitis, okay? So cholangitis is a situation where you have a stone that's permanently lodged within the common bile duct. Now you're going to have two problems. First, the bacteria from the duodenum that actually can go up into the common bile duct is not going to be flushed out. There are going to be no fluids leaving the biliary system, which means any bacteria that climb up into the common bile duct on the proximal end are going to stay there and they're going to proliferate. This is going to cause an infection and inflammation in the area as well as pain. On top of that, all of the fluids that are used to leaving the biliary system from the liver, from the pancreas, and even the gallbladder won't be able to leave. This includes stuff like bile and pancreatic acids, but also stuff from the liver, like bilirubin. So one of the symptoms of cholangitis, besides right upper quadrant pain and besides the fever from the infection, might actually be jaundice. Why? Because the bilirubin from the system gets backed up into the liver, it leaks into the blood, leading to the symptoms of jaundice, which are yellowing of the skin and scleral icterus in the eyes. This is what is known as obstructive jaundice. And these three symptoms of jaundice, fever, and right upper quadrant pain are known as Charcot's triad. They are pathognomonic, especially on test questions, for cholangitis. Now, if cholangitis goes untreated, then you could have sepsis occur, which is when that bacteria gets into the blood. And then you could have a pentad of symptoms with encephalopathy and leukocytosis. Finally, we can have another situation, which is when we have a gallstone that gets lodged in the pancreatic duct. Now we can have a backup of fluid from the pancreas and causing inflammation within the pancreas. This, by definition, is pancreatitis. Pancreatitis presents a little differently than the other biliary things we've discussed because it's going to present with epigastric pain, though it could radiate to the right. So this epigastric pain is associated with pancreatitis, and on labs it will be indicated by increase in amylase and lipase levels. Remember that these are some of those enzymes that the pancreas releases. Lipase is a more sensitive, or specific, I should say, test for pancreatitis. Gallstone pancreatitis is one of the common causes of pancreatitis, along with hyperlipidemia with triglycerides above 1,000, or alcoholism, especially binge drinking situations. Now, when you have a gallstone lodged within the pancreatic duct, it could lead to pancreatitis. So we will have to hydrate this person with fluids like we would with any other pancreatic or pancreatitis issue, but you also need to remove this stone, often with ERCP. So let us know what you think as we discuss a lot of the diseases that affect the biliary system, including cholelithiasis, cholecystitis, Choledocolithiasis, cholangitis, and pancreatitis. Leave your comments and questions down below and be sure to subscribe to see more content like this. My name is Alyssa and this is Medisin.